feel like I can almost hear it. Peg and Peter, just so you know, there's Julie may be coming just a little bit late, as well as Tennille.
Okay.
I think otherwise we might just waiting. Let me just do a quick check. Could even do a quick roll call if that would be helpful, Peg and Peter.
Yeah, that's probably a good idea, and then we can get started.
Okay. All right, so folks will just unmute themselves really quickly as we go through and do just a quick roll call. Peter.
Here.
Peg Miller.
Here.
Brenda Kamini.
Here.
Robin Hill Dunbar.
Here.
Mary.
Here.
Great. Melissa.
I'm here.
Great. Rick.
Here.
Welcome, Rick. Julie. Julie's not here yet. Serena.
Here.
And Tennille, I think, is also not yet with us, but so we'll watch for them. So I think, and Kate Wilcox.
Here.
Great. And then we have a couple other folks we know we want to check to make sure are here. Gwen Bechtel.
I am here.
Awesome. And Benjamin.
Here.
Ruby.
Here.
Fantastic. Okay, so we'll watch for Tennille and Julie. So Peg and Peter.
All right. So let's go ahead and get started. And thanks everybody for taking time out of your busy schedules to meet again. And we have a lot to cover today, so we'll see if we can't get moving. Just a quick reminder about kind of the overview of the purpose, sort of goals of the group that we all kind of went over the last time. If anybody has any questions or comments about that, nothing has changed on that. That's just taken right out of the charter in our purpose. And then we talked a little bit the last time about the importance of being able to work together and how important that is in home visiting the relationships. And as part of that, we have kind of we agreed on some kind of ground rules with working agreements. And I think there's a slide on that maybe.
Yep, next slide.
And as always, this is kind of fluid. So if we find that we need to add to this or alter this a little bit, we can certainly do that. But does anybody have any additions or edits to this before we go any further? We'll maybe approve that, but I was thinking we're going to talk about a way to maybe reach consensus on this committee. And Peter, do you want to talk about the fist to 5 deal?
Sure. So it's pretty simple. It's just it's kind of a polling. You're taking a little poll of the group. With the decisions coming up, ask people, okay, fist to 5. A fist means no way, I'm in total disagreement. 1 needs, we need to talk more about this. Anytime you get a 1 or a 2, the group really should stop, go, okay, what's going on? What is not working? 3 says I'm okay. 4 sounds good. 5 means I'm totally for it. So it's just a way of seeing where the group is in terms of are we moving towards consensus or not. So it's a pretty viable way of doing things. Our collaboration used it for about a year until we got to know each other a lot more. Then we just kind of started to naturally find consensus. So, but we have to be able to see each other when we do make decisions. So that'd be when we'll have to stop the screen share so we can see each other. Any questions on that?
Yeah, I don't think we can change the fingers on the chat hand.
I have a suggestion on that. We practiced using this in the working team, and one of the things that we did is so we would either put the item up that was for discussion or for fist to five voting, and then we'd kind of say 1, 2, 3, and then everybody would put their number right in the chat.
Okay.
And so, or you can also do it either way, but in the chat for sure we capture everybody in that way as well. So Kelly, maybe we can give that a try. Would you show again the working agreements slide? And again, I know Peg and Peter fully believe these working agreements are what they just are, is that they're works in progress, and they can change. If anybody at any time has something that they want to add or change, we certainly can do that. But here's a good chance for us to just test out the fist to five. So again, taking a look at the working agreements, asking, your level of agreement with them, for helping to guide the way that we are together as a committee. And then if you want to open your chat, click on that chat button there, and then you'll be able to share your vote. So let's just go ahead and do 1, 2, 3, go.
Looks like we're good to go.
Yeah, looks like everybody's in agreement. So perfect. Let's we can move on.
It looks pretty good. Did we get everybody? Just want to double check. Serena, did you have a chance to vote? Maybe I didn't see it.
Yes, I did.
Yep.
Yes, I did.
Oh, okay. Oh, I got it. There it is right there. Thank you.
I'm having technical difficulties today with my computer. So sorry.
welcome to Thursday the 6th, I think.
Yeah.
Awesome. Well, that sounds good. We'll revisit those at the beginning of any of our meetings. And again, the other thing I would just share about those working agreements and that fist to five process is that those were part of the survey that was sent out on last Thursday, and then again earlier this week. And it was a chance for you to preview that language and also to do your initial vote on it, but also to give any feedback. And so those surveys, we promise not to overuse them. They're definitely part of the tool kit or tools that we have in our toolkit, though, to keep connected with all of you, since these meetings happen very sporadically. Every couple months is not a lot of contact time. So those surveys are a chance for you to re-engage and to think about the content, and we'll continue to use those. And again, promising not to overuse the survey. So there'll be 1 or 2 probably coming your way between now and the December meeting. So watch for those. For this next section, we wanted to give a chance for our committee members to pair up and to share. Maybe you want to take a minute actually at the beginning of your pair up to share what that first album, CD, 8-track, download, record, whatever that first one that you can remember buying with your own money. Maybe start your pair and share with that so you have a chance to get to know one another just a little bit. But then you'll have about 5 minutes together with your partner, your committee member partner, and we would like to ask if you could take that time and hear from one another about anything and everything, whatever you'd like to bring up from the suggested reading. So any ahas, any uh-ohs, anything that you really are taking away that will help you with the work on this committee. Pretty much just some of your takeaways from those suggested readings. So Kelly is going to help us break out into committee member pairs, and then we'll come back together. Those of you who are not a committee member, we'll just be staying here in the large group. And so enjoy your conversation with your committee peers. See you in about 5 minutes.
Well, I'm going to come off of mute for this one because I honestly do not know if we can do this in Teams.
Okay.
at the more stuff, and there is no breakout rooms available.
Well,
So
that is totally fine. I think maybe we can just,
Okay.
unless somebody else knows.
I've done it before, but it would take me a little time. And I was looking to see if it's an option for me right now. I don't think it would meet your time frame, Christy. So,
No problem.
yeah.
Let's
sorry,
just
I was
pivot really
thinking.
quick, and Peg and Peter, you think we should just do a round robin and hear from our committee
Yeah.
members?
That'd be great.
Great idea.
Awesome. Let's try to hear from everybody. If you want to lead with your CD that you, or tape or 8-track, that would be fun to hear from everybody. And then just take a minute or so, and we'll do a round robin. We'll hear from all the committee members. Can we get somebody to volunteer to go first?
I will be happy to jump in.
Great,
And I
Ian.
put my music thing in the chat there, but I end up having this huge cardboard box full of 8-track tapes in a little tiny car, big box of 8-track tapes. And that question brings back some fun memories of that. I think my big aha moment from the reading, and I was glad to see that Jackson County got some specific analysis.
Yeah, good work.
To see that information. But to me, it's the workforce issue really jumps out. And I look at different programs and say, I really love the evidence-based programs. I love them because they're evidence-based, and obviously, but I think we might have to expand beyond, because I don't know if we can reach enough families if we stay just with evidence-based programs. It's similar to what's happening overall in behavioral health. We're never going to graduate enough therapists to address what we need in behavioral health. I don't think we're ever going to graduate enough people who can be licensed nurses, for instance, for the Nurse Family Partnership and other programs that require that kind of expertise. So that's my aha and my takeaway.
Great. Do you just want to tag somebody next, Peter?
Well, I'll tag Peg. I went first. I'll tag Peg second.
Great. I'm really old, so my first music was a vinyl record, and it was a group called the Four Seasons, and I had a little record player, and I think maybe the song was Dawn. Anyway, long time ago. I enjoyed the reading, and part of it didn't surprise me that we're not reaching as many people as we need to reach. I mean, I think we all knew that. And I agree. I think the workforce thing is a big deal. The other thing that really struck out to me was how important it is to be inclusive and to try and reach those folks that maybe don't have the trust or the resources. And even if it's not evidence-based, I think getting your foot in the door and establishing a relationship with a home visitor will perhaps build confidence to receive future services that maybe are more evidence-based. The other thing that I was struck by was how important it is to invest in systems, that it's going to take some money to kind of get this going. So that's kind of my take on things. Benjamin, how about you next?
I think if I could jump in, I think we'll just stick with the committee members,
Yeah.
just only
Okay.
for the sake of time. Sorry, Benjamin, for jumping in.
Let's see. How about Melissa?
Well, I'm not gonna lie, I did not read all the reference material. But I will say that, we do have to support the workforce and we have to think more creatively about it. So to Peter's point, like what's evidence-based and what's not, do we need a certain level of person to be doing home visiting? And we're always kind of struggling on the health plan side, like, do we need an RN Do we need somebody that's a traditional health worker, community health worker? What's the level of expertise we need? And it's different for each program's requirements. And maybe the nurse level is only needed at a certain juncture, or with a certain component of that treatment or program. And so that's one of the things that we're always trying to juggle. And, we fund a lot of different community-based organizations and projects around the Lynn Benton Lincoln region, where we operate as Intercommunity Health Network CCO. So we really have a bucket of money that we have a lesser amount of funding for, so under 50,000 for newer, innovative kind of startup, rather than, the larger grant amounts that we give to organizations that have more tried and tested, and they've been around a while and they've been working in that space in particular. And we do that so that we capture those really interesting, innovative things and grow in different ways. Some of the things that we've done, like thinking about, not this is not maternal and child health, of course, but thinking about how we are working to connect clinics to community supports and doula, midwife concepts. Like, what are those barriers? We need to talk to those practitioners. And is it a barrier of staffing? Is it a barrier of idealism? And really thinking about it with the right people at the table that have to do the work. And what does it mean to do a warm handoff? And how is that even working? Is it working? Was the concept good? Because, some of us know, like probably you, Peter, it's different to present policy than it is to implement it, right? So all of us should have a little bit of experience in that space. And so how is that going? So I think just we do have to think outside of the box to really solve some of these issues that we're not used to solving all of these things upstream.
Yeah, true.
I'm sorry, did you want to know about my tape? I wrote it in there, and I had Tiffany. That's the first one that I really remember. I could have been like 7 or 8 or something. But yeah, Tiffany was cool back then.
Just so folks know, I put
Yeah.
the committee members still to share in the chat, just for a little bit of scaffold there.
I'm happy
So
to
I will just start with the first one, then Robin.
go
I'm
for it.
passing to Robin.
Thank you. I love Tiffany. Tiffany should never get out of style. None of these. I love all of these. They're such great. Mine was
That's
Ebony
good.
and Ivory, and I literally remember buying the little records. Remember the 45s that were small? The flip side was not a song you usually knew. It was such a good time. I also love the 8-track reference, Peter. So thank you. One of the things that I was thinking about when looking at all the documents, especially like the matrix, is how many assets we have in the state in terms of programs. And we have diverse family needs, we have diverse model needs. And that was really striking me that like we have so much in Oregon to build on. And this systems improvement is just going to help us to make most of all the assets that we have. So I was excited to think about that. And that I wanted to build also on the evidence-based conversation that I think Peter, you started and others have added to, because I feel like, especially over the past couple of years, what we've learned is the way we've all done things in the past. So for evidence-based, for example, has been important, and yet families, our communities, our own families, our own way of doing things is requiring us to think again about how to do things in a different way, how to be more flexible, how to be more vulnerable, how to look at things with fresh eyes and say, that served us before, but what do we need to do now? And I just find us needing to be able to pivot. We like overused that term, flexibility, pivoting, all those things. We got really like tired of hearing it, but I actually think it's required. And when I think about our behavioral health, as mentioned, and I think about home visiting, families are just going to require that we think about what it means to be evidence-based. So while I come from a long line of loving evidence-based research and all of that, I think like what will it look like for us to feel confident in the services and quality that we're providing families, while also responding to them in sensitive ways and being flexible with programs in a way that still maintains quality. I have friends on this call, Beth and others, that I think you guys will help us figure out how to make sure that we're doing things in a quality way. But I feel like that's what was coming up for me, was just re-examining. Workforce is always how I view this in terms of like the workforce. How do we support the workforce? How do we build the workforce? And when I was reviewing all of the documents on that, that's what was coming up for me. Like, how do we prepare the workforce and support them in providing quality while also reimagining our rigidity of the past? So a little bit all over the place. I'm just excited to have the conversations with all of you today. I am going to pass it. So who's going to look at that little chat list again? Who hasn't gone? Yes, the next is Serena.
Okay, I'm a little old, so I think I didn't buy them. I used to just listen to my grandmother's music, and I love the Crusaders because I love a little jazz. That's a little old, I know, for some, but oh well, I love the Crusaders. But I think the first one I ever bought was the Emotions. Yeah, because I love singing, and so the soprano voices always drew me in. But as far as the work, I just think that when we talk about home visiting, I think about relationship building culturally. And when we talk about practices, I think about promising practices, because culturally, a lot of we want to reach out more to our 9 tribes. We want to reach out culturally to folks outside the norm. And we look at where we are, over 40% of our kiddos are kids of color. We have to start working outside of the box and doing things non-traditionally in order to reach those families, to gain those trusts, especially as we're doing home visiting. And my thing is, during the pandemic and right before the pandemic, we trained up all these community health workers. We need to start using them and bringing them in as part of our work when we talk about home visiting, because they know the communities in which they're in. They have the trust of those communities. And that's part of those parts of promising practices that can then go into best practices, right? After we've done them for like 2 to 5 years. And what does that look like? And then also using nurses as consultants for our community health workers to be there. They cost a lot. And we want to make sure we're having the best use of their time when we're doing this work, and not just bringing them in on menial things, but what our community health workers are going to be, what's going to get us there when we're talking about home visiting and doing those things and working outside the box. I love working outside the box. Community engagement is my thing, and being collaborative. And our rural communities, they know what they need, instead of us going in and telling them what they need and putting things in there for them, but talking to them and seeing what they need in those communities when we're talking about home visiting and what works and what doesn't work. And that's my 2 cents. Sorry, I get so passionate. So
Julie, why don't you go next?
I'll go with Julie. Okay.
Are you talking about Julie Seastrom?
Yes.
I echo what Serena had to say. I'm so thankful to hear commentary about 9 tribes. Anything that everybody else that's on the call that can do to support 9 tribes and reach out to each individual of the 9 tribes and their social work programs and their health programs and their education programs with the work that you're doing, we sincerely appreciate. It's a different world when you're talking about tribal world and other nations. So I'm so thankful and grateful to hear Serena's words. So those are my 2 cents.
Thanks, Julie. Rick, how about you?
I think I put in the chat, I think the key was the first music I purchased, and I think that was Men at Work, although I did have a bunch of 45s. I think my parents were kind enough to purchase for me. I think Andy Gibb is something that comes to mind. But I sincerely apologize. I did not get to the reading. I have too many balls in the air. That not excuse, just it's truth or explanation, I guess. But I will get to it, I promise, before the next one, and read the next one as well. But I don't know that I would have a lot to add, being the housing guy on the group. Just really appreciate everything I'm hearing. I see a lot of parallels with what we're trying to do in housing, particularly with the engagement and the outreach, and the equity and racial justice piece. Just trying to learn and hear from all of you. So with that, Mary, I think you're next.
Sure. You guys are going to realize how young I am when I share my music, but my first CD was in my first cassette tape was in 3rd grade. I bought Music Box by Mariah Carey, still one of my favorite albums of all time. And I won't repeat a lot of what's already been said in terms of underserved populations standing out to me and the specific needs of families of color in the assessment. But the other piece that I don't think has been mentioned yet, I think because of my role within child welfare and our Family First work, I was really reading through it, thinking about how to layer funding streams and be strategic in building the systemic side of things. I think there are a lot of opportunities there, both for evidence-based practices through our Family First Act, but also child welfare has some funds from the system of care to also invest in other prevention efforts that are not tied specifically to evidence-based practices. So just wanting to think about how we can help contribute our part to building up the system and making it available with kind of particularly thinking about those underserved populations and places where we really need to expand what's available for folks. So I will hand it to Brenda.
Interestingly enough, with the music, I really more remember tugging off to college and taking a stereo system with big speakers to set up in my room for record albums to be played. Isn't that crazy? And in this day and age, can't imagine it. Anyway, for me, because it was such a vast amount of information, I did a little picking and choosing in what I dug into. So appreciative of the McVie needs assessment. And I have to admit that I had only seen portions of it before relative to our region. And I'm wondering if there isn't some application sharing of that more broadly that would be helpful, since I'm within a hub system, thinking about how that plays into the needs assessment that all of us are doing and how that could contribute. So want to maximize the use of that in analysis around the state, I think. The other piece that I was particularly interested in was really digging into the document that shared what the different models look like, and what I would add to the conversation about kind of how we think about the array of services is, I think there's the piece about evidence-based or promising practices, but I think there's also kind of a crosswalk to happen in how that array of services shows up in a community between nurse led home visiting and paraprofessional home visiting and that there's room and a need for both. And so that sort of spans the conversation about the expense and how you set up an array of best match for your community. And that also actually kind of leans into that work. We're just having conversations with doulas and doulas that are providing services to our Native populations that's specifically supportive of their beliefs and traditions. And within the workforce structure that we're building here with the community college, that lived experience isn't necessarily a solid part of the conversation. And I think that's a challenge to us across the state. So with that, I will turn it to Kate.
Thanks, Brenda. I think I put in the chat, my first album that I bought was Three Dog Night. And good God, I don't even know any of the songs, but I just remember the flip side had one that was a little racy for the time. And my mom heard it one afternoon when we were playing it in the basement and she was ironing and she was like, "What is that?" So, but I'm the youngest of four, and I just remember my older siblings playing their 45s, and one that always stuck in my head was Tommy James and the Shondells, if anybody remembers them. So I am dating myself a little bit, but all super fun. So I agree with everything that's been said. A couple of thoughts that I have. One, I was thinking in terms of like the work we're doing and as we're moving forward and taking those, the questions from the Oregon equity lens, from the OED piece, those questions were really quite poignant in the sense of, you know, every step of the way we should be asking these questions so that as we're moving forward with this work, we're doing it, we're heading in the direction that we want to be heading in, that Serena and Julie were sort of articulating as well. I mean, I live and breathe this a lot, so none of this was super surprising to me, but one piece that I thought could also help us focus, the problems are vast, the need is vast. How do we wrap our hands around this? And on page 78 of the needs assessment, it talks about from the families, what are the 5 barriers that they experience? And I felt like that's sort of the end in mind. We want families to feel engaged and be able to access this service in a way that's relevant to them. And if we kept those as sort of our North Star of destigmatizing, having the outreach to connect with families that so they even know this is there, looking at the program eligibility requirements, and that leads to the evidence base, the promising practice, the best practice pieces, intimidating screening processes and paperwork. Oh my God, you know, whatever we do, we need to make sure that we're using and that families know why we're collecting it and it's relevant to them as well. And then of course, making the programs accessible to where families are when families need it. I mean, those are sort of the end North Stars that I hope that we can kind of keep our eyes on. I did want to say something about the expenses of the different parts of the workforce. I think we struggle a lot in a lot of our social services that we can't get enough support or resource or salary, if you will, to those who are doing the really, really good work. And so, yes, nurses cost more, but does that mean that we don't pay doulas or community health workers more? I mean, they're doing really awesome work. And so part of it is elevating all of the home visiting provider types to a place where they're compensated for this really important work that they're doing. Because I think I agree with you, Brenda, there is a place for everybody. We've got to have nurses on the team. We've got to have community health workers on the team. We have to have paraprofessionals on the team. It's going to take that village of providers to really wrap around our communities. So I think that's all I've got. Oh, and Tennille, you're next. Sorry.
I don't think Tennille's with us yet. Tennille?
Okay.
Yeah, no, yeah, we'll catch her and we'll catch her when she arrives. She let us know she was going to be running late. Peter, should I move us on to this section here?
Yeah, I think we're moving on to the home visiting programming and funding streams.
Yeah, so just the briefest of reminders that there was a request to understand more about the array of home visiting program services in Oregon. So we've included a few of those in your packet, so you can find an overview there, I think. And then Benjamin's going to just do a quick walkthrough on that, but also around funding streams as well. So more on this later. We're not going to spend a lot of time here because we want to make sure that we really give our presenters time to do their to present later this afternoon, or yeah, later this afternoon. So Benjamin, I think we're ready to go. Kelly, back to the slides as well.
So as we continue to refine and better understand what the full array of home visiting services are in Oregon, and the importance of doing that, as Brenda alluded to, in terms of what is the best mix for any individual community. What seems to be emerging is that, you know, we have all kinds of ways of identifying home visiting. Some are very brief. They might be 1 or 2 visits. Others can be prenatal all the way up to the child turns 6. For many home visiting programs, the act of home visiting is the primary intervention with the family, whereas there are other home visiting programs for which it's just a component of a larger comprehensive service to the family. I have, in my experience, always known home visiting models to prefer people who have lived experience. But there are some home visiting programs for which that is a much more important criteria in making personnel decisions, whereas others, like it was noted, for some home visiting programs, they do require a nursing degree. Some home visiting programs are limited in their reach, and when I say limited, that could be where it's located versus if it's a culturally specific program, and so it's limited to a specific population, whereas others have much more comprehensive reach and might be a statewide program and available everywhere. And similarly, I would say that I cannot think of any program that doesn't receive more than one source of funding. But it is clear that we have some home visiting programs that have as many as 5 or 6 different funders for which they're responsible for reporting and balancing their books, et cetera, et cetera. So it's a really wide range. And before leaving this slide, I just want to say, to be clear, a home visiting program or model doesn't necessarily live on one side of this or the other. You could be limited in reach, but still be an extended duration program. You could be brief and have a comprehensive reach. So it really, there's so many configurations and components of this. But one thing that is clear of all home visiting programs is that they are voluntary, they are relational, and they're really focused on the family health and well-being. So then the next slide is just examples. I believe these were included in your packet. The first example is the appendix in the 2020 McBee Needs Assessment. The second is, as you see, a draft. We're trying to take our time to understand really comprehensively what are the different components of all the different models so that we can better understand how we do create those sweet spots in the communities with the right services in the right places. And then I think Gwen is going to talk about funding. At least that was my memory.
Yeah. Yeah, thanks, Benjamin. We could go to the next slide. I'm not sure.
Yeah, maybe the next slide, one more.
Yeah, sorry. Nope, that was a good place. Sorry. So that was our placeholder to go dive deeper into this slide, which this is meant to just be a very broad brushstroke. This is not complete or comprehensive. We recognize in all the different services and also funding streams that are in the home visiting system. So we've been working on trying to gather as much information as we could, but For today, we've already identified, and this would be on an annual basis, over $395 million invested in the home visiting system on an annual basis. And those investments are coming from a variety of different sources, to Benjamin's point. So we have federal, state, local, and private. And I think what's kind of interesting whenever I was looking at this information is that the federal and state investments, at least from what we've been able to gather so far, are almost aligned. You know, they're almost equal, which was, I wasn't sure what we'd find whenever we, you know, started to compile some of this. And so in the federal investments, and these are some of the programs that, you know, if you can read down the smaller print, some of the programs or grantees that are receiving federal dollars. And these can be grants from the feds that are going from the feds to state or fed to local. An example of the fed to local would be a Head Start program. And so, so we do have some federal funds that are coming in and not going through a state agency. And then we also have the title funds included in this, and also Medicaid. And I think it's important to note that these federal funds are coming into multiple different agencies at the state. So, you know, to name a few, the Early Learning Division to become DELF, the Health Authority, ODHS, and others, right? So, I mean, they're coming from all different state agencies as well. And then when we look at the state funding, this includes state general funds. This includes other funds, which might be, it seemed like what the majority might be coming from the Student Success Act through the Early Learning Account, but then also there's for like Relief Nurseries asset forfeiture. So there's a few different state funding streams as well. And at the local, this was really the only one that we've been able to identify so far is the Portland Children's Levy, which is around an annual budget of $8.2 million, but they're actually distributing those funds to over 19 different agencies in the Portland area. And then in the private sector there, this is, we were able to identify like Ford Family Foundation, also the Oregon Community Foundation, and then also Relief Nurseries are required to have a 25% cash match. So they're doing local fundraising in support of their services as well. And again, I just want to make that caveat at the bottom here that we are definitely missing some investments. So like these, please, you know, this isn't an exact number. This is really just meant to be some really broad brushstrokes for you today. And then if we move to the next slide, I really wanted to kind of focus a little bit on like, you know, when you're funding a system, it's like kind of the whole is greater than its parts. And, you know, a system is a group of interacting, interrelating, and interdependent components that form that like unified whole. And that as we're thinking about systems building, they're like, this is from the association, the Administration for Children and Families. You think about context, so that's like the political and policy context for the system. And I would say kind of the work that you're all involved in on this committee is part of that. And then there's the components, which are those high performing programs and services. There's the connections, those linkages across the system components that sort of leverage or improve the service outcomes for families involved. The infrastructure, which are the supports to make sure that that whole system is functioning effectively. And that infrastructure could be at the state level or at the local level, and probably other levels in between. And then also the scale, so ensuring that the system is available to as many people as possible. And I think about this as kind of that equitable access component of these 5 different considerations. And I highlighted number 2 and 5 because I think we have sort of more information about what's happening there. We know we can identify in that one document, I think that Benjamin just referred to, that's in your packet, like what's our, you know, scale, like how many children in each of our programs are being served or how many families on an annual basis. And then the components, like what are those services? You know, is it Healthy Families Oregon, McV? Is it a child abuse prevention program? So I think that those 2 areas we have more information on than we do about sort of the system itself and thinking about like the coordination collaborations in the system side. And although we know that many of these funding streams and investments are supporting that, it's really hard for us to kind of parse out what percentage of those investments is actually going towards that type of collaborative and system building work. And I'd also like to say that for numbers 3 and 4 here, we really think about those areas. That's like a space also for some of those shared professional development opportunities and sort of those linkages across programs around workforce development and stability. So I think I'm just trying to go quickly, Christy, because I am very aware of time. So anything else that any of the co-chairs would like to add at this point?
I would just add one thing if I could, Gwen, and I think it's maybe it's obvious or maybe it's not obvious, but even knowing that the level of program funding is in the hundreds of millions of dollars, we know that from our last presentation from Benjamin, the reach is maybe at best about 30% of our families, and that's a really high estimate. Some estimates are lower, like around 8 to 10%. So even at that high level amount, our reach is not universal. It's not totally comprehensive, but it's yet a large number. And then the counterpoint to that I'd like to just have you all think about is we don't actually have a great number, as Gwen was suggesting, on how much is really going straight directly to systems. It's really muddy. But I would say that in terms of direct, absolute focus on home visiting system building, it's very low. Things that are really asking for that support of the home visiting network, either from the state or the local level, we don't have a lot of direct targeted investments at those things at this time. So I would just highlight that distinction there a little bit.
Thanks, Christy.
Thank you, Gwen. Should we move to Ruby? So thank you. So those are your kind of updates, committee, on the funding programming, which those cheat sheets are at the end, and we'll be continuing to work on that new matrix, and then also we'll work on the funding matrix and continue to get that in a more mature state. This next section, though, Ruby Ramirez, and just also Benjamin Hazelton and Gwen Bechtel, and now Ruby Ramirez, those are your co-chairs for your working team for the subcommittee of this committee. So I wasn't sure if we had actually introduced everybody in that way, but welcome and thanks. It's been great to work with the three of you. And Ruby, you take it off with, this is an update for the committee on the working team's work over the last couple months.
Yes, thank you. I see some familiar faces. But again, my name is Ruby Ramirez. I use she, her pronouns, and the program officer for early childhood at the Oregon Community Foundation. So thanks, Christy. I'm going to be providing a brief update on the work team's process and progress. So this first slide should look familiar to you all from your August meeting. It provides our basic timeline, leading us to recommendations in December and implementation planning beginning in January. And then the next couple of slides, the next few slides, will show more detail about what's been happening in the process. So the team is working backwards from December and analyzing data in 3 phases to find some common themes in 3 areas: parent and family experience, home visiting workforce, and home visiting systems. And we'll see that a lot of the comments that you all have made in terms of your ahas were included in, were found as themes in this analysis as well. So every working team member, as well as the co-chairs, are reading a set of reports and data during each of the phases. Our plan is then to share findings with relevant stakeholders for feedback in each phase. So we've led with parent and family voice and experience as phase 1. And we really felt that the best way to honor and respect families was to look carefully at what they've already told us about their wants, needs, and experiences. So we reviewed and analyzed a collection of reports and data from parent focus groups, both from within home visiting and within early childhood more broadly. We're sharing our phase 1 data analysis findings with as many family and parent groups as we can during October for feedback. For phase 2 feedback, we'll invite home visitors and supervisors to critique the themes that we find in home visiting workforce data. And for phase 3, we'll ask for a critique of our analysis from home visiting and early childhood systems leaders. From those 3 phases of analysis and community critique, we'll develop recommendations and prioritize them in terms of the urgency and importance. All of the recommendations will obviously aim at improving coordination and collaboration of Oregon's home visiting service network. We want to quickly show you the list of readings the work team used for its analysis in phase 1. We had some core readings for the entire group. That's the first list, and then a set of additional readings that folks chose to memorize at their discretion. And so this was our approach to the analysis. As I mentioned, folks read a collection of reports and data. We asked them to capture themes in terms of what's working for parents and families, what's not working, and what's missing. We also asked folks to use the Oregon Equity Lens as a guiding tool in their analysis. The team found many common themes in the readings, which we grouped into 4 big buckets that I'll share. And as a reminder, these are themes from phase 1 analysis only. Ideas about recommendations are emerging, but we don't actually have recommendations to share yet. So probably unsurprisingly, we see that what's working in one community may be insufficient or lacking in another, but what was important to families was relatively clear. So the first bucket here is about the types of supports families are looking for. They're looking for basic need supports and community resources, which include things like food and car seats and childcare, mental health supports for caregivers and children, and parental and prenatal supports. Families also value supports that help build parental resiliency, so emotional supports that prioritize the well-being of the family or seamless family. And these can include avenues of peer support as well. Leadership opportunities and tools for self-advocacy were also called out in these reports. Parents want programs that meet individual family needs and offer flexibility and eligibility, frequency, duration, and availability of home visiting services. So everything that Benjamin talked about earlier. And finally, families want better access to home visiting services, whether that means remote services, hybrid options, or more place-based services in rural and frontier communities. The second big bucket is about making it easy for families. Families want a seamless and easy to navigate system. And so this includes coordination between programs and services and simplified screening, intake, and referral processes that are not onerous, duplicative, or intrusive to the families. And a big theme, and I think somebody said it earlier, was around warm handoffs for referrals, and that's a trust piece, and support with transitions between providers and programs that, again, create an easy and navigable experience for families. Next slide, please. So what's important to families once a family is receiving services is our next bucket. The first bullet was a major theme, again, trust and trusting relationships, which is also tied to the last slide about, like I mentioned, families want to feel comfortable and they need to trust their home visitors, not just the home visitors, but every other service provider they interact with. So like a warm handoff, that trusting relationship needs to continue after the we also saw a desire for cultural responsiveness and culturally specific programming, which would likely increase access and buy-in for home visiting services. A culturally and linguistically diverse workforce and robust language supports for programming and outreach are important to really supporting families in this work. And we saw that in some places, it's sufficient to have Spanish translation and Spanish materials and cultural responsiveness around Spanish language and culture, but it's not just Spanish. There's a variety of other languages that need to be supported as well. And families are also looking to home visitors to serve as advocates and navigators, and especially when they feel that a system has already failed them or that they've been ignored by other service providers. Here again, a positive and trusting relationship really makes a difference, and families may be more likely to keep engaging with services if they feel like someone actually has their back. Next slide, please. So finally, the last bucket was around messaging and outreach. There is a sense that there's a general lack of understanding and awareness of home visiting services from a variety of sectors. So these include the general public and families that might use the services, healthcare providers, administrators, and legislators. So generally, increased promotion and outreach that increase asset-based language was desired to help reduce stigma around home visiting. And when thinking about promotion and outreach to families, cultural responsiveness is important, as is working with trusted community partners to disseminate information. Again, we will be asking for feedback from family and parent groups during the month of October to help guide the development of recommendations. And this was kind of the bulk of the themes. There were some other themes that came up that might fit a little bit better with the workforce conversation or the systems conversation. So we'll bring those back then. And our next work team meeting to analyze phase 2 findings is slated for October 24th. And then thank you for listening.
Great. That's excellent info. Thank you so much. Are there questions or comments from people? I think my favorite section is making it easy for families. That we hear that we are a family advisory council here in Southern Oregon. That's their constant message. Life is hard enough. Any other comments, questions, maybe?
This is Kate. So along with the music theme, I was thinking of the song, I Get Along with Little Help from My Friends, right? And that just I really appreciate the destigmatizing and normalizing of home visiting, that's really important, that we all need help from time to time, and that's a shift in maybe how we move this all forward, that and trying to create a space where anyone can get support whenever they might need it. So,
yeah. Thanks, Kate.
I think the other thing that stood out to me was the request around basic needs and community resources. The research is really clear in the foster care prevention research that concrete needs are a really important part. It's not just about the parenting skills. So I was excited to see that show up in a lot of the home visiting models, as well as hearing it here from families really reinforces that being an important aspect.
Absolutely. Absolutely. Any other thoughts? Well, if not, Peg, I'm going to pass it on to you. I think you're next on the agenda.
I think what we were going to do next is reflect a little bit about the discussion. We kind of already, in the sort of question period, we already sort of talked about things that excite us or any questions that have come up. I applaud the working committee for all the work that they've put into this, and putting it in such an organized manner really helps me to understand, as a person who's already a believer in home visiting and has seen firsthand how it can help families. I appreciate that sort of organized breakdown of the ideal sorts of systems and how they're going to look different in different communities, and that the needs for individual families are all quite different.
Mm-hmm.
Other people have thoughts?
Again, some good comments in the chat, so appreciate that.
Mm-hmm.
But to kind of stay on top.
This is Melissa. I was trying to get off of mute, but yeah, I would really like to second that. There are different needs in different communities, and for IHN CCO, we operate across 3 regions that have urban, rural, and frontier aspects to it. and the needs are very different across the board. And when you think about meeting people where they're at and the cultural appropriateness, and it's important that we also integrate peers into the programs that we develop too. And I know there's a little bit of that going on in different spaces, and that's much appreciated by the individuals in our community.
The other thing that really stands out to me is the need to sort of brand this, that is to send fairly consistent messages about what these programs are and are not, and kind of find the secret sauce to make it non-threatening and non-stigmatizing. And certainly some of that is going to be word of mouth in some communities as programs establish trust with families, but also messaging to providers and to other referral sources, so that we can identify what works and what doesn't work.
Peter and Peg, I think we might be ready for that 1-minute stretch break.
All right.
If we want to share the slide again, Kelly, really encourage everybody to actually take that, like whether it's like a literal standing up or a figurative standing up or a hand on your heart and a really, really big, deep breath, or hand, the elbow grab, the quick twist, the go get a glass of water real quick.
All right, we got to read the comment.
I have been delighted to be cutting these out of the newspaper recently.
It's good.
Those are good.
Drama. I feel like I might be a dramatologist sometimes. Robin, you got to take a look at that one on the right. Peter and Peg, while we're in this spot right here, I just want to do a quick time check with you. And I'd actually like to ask your permissions to very much truncate this section around the statewide home visiting system so that we don't shortchange our presenters. So I might do a 1-minute show and tell and then move along to the Ford family and Beth Green. What do you guys think about that?
I think that sounds fine.
Outstanding.
Okay. And then,
yeah.
Okay, let's make sure we focus on that. I do want to make a couple points on that item, but we don't need to do quite the walkthrough.
I love the comment in the chat. Boy, you thought the committee reading list was long. the working team list is, my gosh. I also love the chart your own adventure, choose your own adventure. That's a
my old favorite books as a elementary school kid. Maybe folks could just popcorn into the chat and just say that they're back and ready to go. Maybe just a here or a yes or let's go. Anyone is welcome to send me a comic strip that they would like to have as the stretch joke break. This is a public meeting, however, so bear that in mind. Great, just as you're coming back, just give us a little thumbs up or a yeah, I'm back in the chat so we know everybody's ready to go here, and we'll start back up in just about 30 seconds. Okay, great. Well, for this next section, I think we had planned a little bit more time, but we do not want to shortchange our presenters in any way. So I'm going to spend 1 minute on the next 7 slides instead of 7 minutes on the next 7 slides. But I don't think that that's a bad thing. And I would actually now add this to your homework reading. So the last time that we were together in August, we had a section called What the Heck's a System? And I believe that that is our question that we all have to answer for ourselves and as a committee for home visiting systems building. And while it is hard to get ourselves out of the programming level, that is our job. Our job is to think at the systems level. What are the systems of support at the upper level statewide? What are the levels of system support at a regional level? And how do those support programming quality implementation? So the programming piece is all of that systems work is always in service to the programming piece. And so if we looked at this list here, just very briefly, the governance, administration, financing, assessment, planning, monitoring, continuous quality improvement, PD, and training and technical assistance, those are all component parts of the system. North Carolina has labeled theirs home visiting and parenting education system. And these same component categories come and are directly mirror those from a build initiative resource tool. And if you could go to the next slide, Kelly, I'll only show and tell 2 slides, and then I will point you to where that is in the packet so that you can spend some more time. So the component is listed at the top of the packet, governance and administration. Every one of the components talks about what it is, why it's important, the types of activities that would relate to that component. And then it has a Q&A or a question section that helps state leaders think about what it is under that governance and administration piece that's important and what might be in place and what might not be in place. So on this slide and then on the next slide as well, I'm just going to highlight, like, these are really focused again at that state system. What is the state doing to support home visiting coordination and collaboration? And what is the regional level doing to instill coordination and collaboration in service of programming and quality programming of home visiting? And if we went to the next, financing strategies and funding mechanisms, can we go back one actually, Kelly, to that financing? Thank you. I think this one does a great job to exemplify what I'd like to have you guys leave with. So the way that this is written, it really talks about trying to do what Benjamin and Gwen particularly presented on, which is trying to capturing all these different funding streams for all these different home visiting programs. And that is very important for us to do systems work. And I'll say, ask yourselves as committee members to go up one level and say, what are the financing strategies and funding mechanisms to support systems development? What are the resources, human resources and time resources and other financial resources that are needed statewide to support regional home visiting system building in service of programming? And that'll be true for the next slide, Kelly. Assessment and planning of the system, accountability and monitoring of the system. Right, a lot of the language in this build tool is important for us to think about and then also translate into systems level questions. Many of them focus on that programming piece, and that is essential to our work. It is why we're here. And what is it that we're trying to build to help support all that programming in that coordination and collaboration language? So I'm going to leave you with that piece there, and I'm going to hope that those hand gestures will stick with you. So our job is thinking at this like high level state. What is the support happening at the state level from any and all agencies that help a regional implementation of coordination and collaboration that lead to quality programming? And ultimately, hopefully lead to more programming. But this systems development work is not necessarily about expansion of programming in the short run. That's the long run. And so thinking about like all the things that are as our job as a committee to be thinking about are those coordination and collaboration elements at a statewide level and at a regional level. So I thank you for your patience in hearing me out on a few of those points, but I think I would really recommend that you spend time and study this because this is our language. This is the language of this committee. It will be the language of the working teams. We will definitely be using pieces and parts of this resource tool as we move forward. So with that, I'll leave you as an additional homework piece to look at before our December meeting. And then we can move forward, Kelly, to the regional home visiting system piece. So in thinking about that big hand gesture, the state level piece being one that's not built yet, and the regional piece being one that's not statewide, but we have two excellent examples in South Coast and South Central Oregon. Robin Hill Dunbar, Senior Program Officer from the Ford Family Foundation, and Callie Lamberth, a Senior Research Associate from Portland State University. They'll be doing a presentation for the next 30 minutes to highlight what the elements are and what's the evaluation and the lessons learned from this regional home visiting systems project. Robin, on to you.
Thank you. I think there's a next slide. Oh, so there's one slide that's missing, but what I would say that was important to me about that welcome slide is the work that we have been doing for a number of years, really that started with the leadership of Christy Cox, so she can help me with any of the pieces, but is in partnership with the South Coast Early Learning Region and Hub, in partnership with the South Central Early Learning Hub and Early Learning System partners, with PSU's team, which Callie's going to share from the PSU team, and from Ford Family Foundation. I'm trying to think if there's any other, oh, well, I will say that we also are in partnership with First Five Siskiyou County, California, even though I will be obviously talking about Oregon today, but we view all three regions in the same way. Although it is complicated, different states have different ways of viewing this. So it is fun to see the comparison and ask ourselves questions often. I was really appreciating so much of what you were just framing, Christy, on those last slides. And so I'll be just encouraging people from the conversations we've already had, as you're listening to myself or Callie present what we've learned, like think back about like external communication and some of the things about marketing and messaging to families. Like there's a lot of things that you will hear maybe start to be patterns. The local coordination and collaboration, when Christy's doing that, like at this level and at this level, like we definitely, when we're thinking about the system change, yes, ultimately it's because we want to serve more families. Ultimately, that might result in more programming, because to serve more families, that might be what we have to do. It is what we'll have to do. But in the short term, to work on the system, we're really looking and starting at the close level of coordination and collaboration. And so what I wanted to illustrate, I know that the first meeting that we all had together, I did get to talk briefly about the strategies, and we just boom, we just said a couple of things about the 4 strategies. Today, you're going to get to hear from Callie about the research and data about those in particular. And so I hope that you enjoy that. But what I wanted to just start with is just a little bit, I'm just going to pull up my notes, a little bit of the pieces before the strategies in our theory of action. Our theory of action really is our guiding document. And I say that not only all of us, when I named all those partnerships, that is our bumpers. Like that's what we go back to. That is our North Star. I think that when you're trying to do things in more than one region with more than one mind and with the collective thinking, you have to have something that is in black and white that says what we're doing. And that's really been our North Star. But really was developed in partnership with community, not by any one of us. And so I also think that the most critical thing, so the values of what I wanted to just touch on real fast, because it is at the beginning of our theory of action, and it really is a reflection of what we all have collectively talked about as what drives us on this work and the values. The most critical component is trusting relationships, which is much more complicated, we all know, than just what the term might sound. And so you hopefully will hear lots of versions of what trusting relationships means and what it means to the work that we're trying to do through the next few slides, but don't change slides yet. So also in the values, our family voice is very important, the use of data. We value working in partnership and in alignment with other state initiatives. While we want to be innovative in this work, we have been really able to be innovative. We also don't want to work in a silo or not be sort of in pace with what's going on. So we really do value alignment, but we also truly value equity for all families, and especially those historically underserved and marginalized. Our shared mission, I kind of already alluded to it, but I think it's good to say it again, is like improving the system of coordination of accessible, culturally affirming, quality home visiting programs and family support services so that more children and families are served. And that we, of course, you can imagine the conversations and the noodling over semantics and words and everything. So I say it all very carefully because I feel like we took a while to get to exactly what we were trying to do. And our vision is alignment with the state, and obviously that is what was in our values, but also that we believe the home visiting supports help to ensure that all children are raised in healthy, stable, and attached families, and that the importance of early learning systems being aligned and coordinated and family-centered is really important to our vision of this work. I would like to just point out an important component of the project, the resources. So in that theory of action, that resource column, it really is where I think private or philanthropy has the really clear role in trying things, but being innovative and because we're so flexible. But the resources in this particular project was really important. That we know that there's a lot of unfunded things, like you're expected, of course you should work with other home visiting programs, and of course you should work with all the partners serving families, and of course you should do these things. But having someone whose role, the coordinator, whose main focus, their job, that is what their job is to do, is to coordinate and build relationships. We wanted to see what it would be like if you had a full person. So when I named those 3 regions, there's a big geographic difference, there's a big number of people, population difference and everything, but there's like a full person that is their role, and that is critical. We also think that person's role needed to be model neutral because that helps in building relationships and the competitiveness that may or may not be in community. So also so that they're supported and proving skilled facilitation and coordination roles. So we provided meta coordinator, we call that role. And the meta coordinator is really helping those coordinators with the roles of how do you facilitate difficult conversations? How do you have meetings in a way that is building relationships, and how do you reach out? How do you do these different things that maybe you take on the new job as a coordinator, but you're like, I don't know who, no one prepared me for this role. And so the meta coordinator role was really coach, guiding, providing a parallel process of support, which in the home visiting field, there's a lot of conversations about parallel process. And so this fits in this project as well. They had some retreats, they got away together, they connected together, and then that helped them be present, have trusting relationships so that they can then offer that to their partners in bringing people together and building relationships across sector and models. And so also in the home visiting field, some of you will recognize that kind of that parallel process of providing it for the home visitor as a supervisor so that they can then be present for the family, so that the family caregiver can be present for the child. So there's so many ways and layers of this that I just love. Also for resources and providing, I'm going to say, the best and most robust team of evaluators that you're going to hear from Callie, and then also Beth as the lead on all of our evaluation, but really on this project, Callie has been the lead. And we wanted to make sure we had all of those resources in place so that we could, as you can imagine, it could guide the work. Are we doing what we, continuous quality improvement? Are we doing what we said we were going to do? Are we following the lead of the community? What is the community saying? What are the partners? What are the stakeholders saying? And then what do they say? What do we do different? And so constant continuous quality improvement. The data is we all have learned to love data. Data is our friend. And time is a resource. While it's not listed here, I want to say that time is really important for systems work and systems change. It doesn't happen overnight. It doesn't happen because there's a document that says to do it. and relationships take time, and it is key in all of this. So I'm going to turn it over to Callie Lambarth from PSU evaluation team to dig a little bit deeper into the strategies, and I'm excited to let her share those slides.
Thank you so much, Robin. Could we go to the next slide, please? Thanks. So I'm so happy to join you all today and talk a little bit about the Home Visiting Systems Coordination Project evaluation. And so we're going to go on a little data journey together today. Could you go to the next slide? And so first, just want to orient you all. You might already be familiar with the project or the evaluation, but just want to ground ourselves in the purpose of the evaluation for this project, which is really, there's multiple purposes. And so it's, to both inform the pathway, so to understand existing needs and strengths of communities, as well as to inform decision-making about next steps in the planning and implementation process of the work. It's also to help describe and document what that process looks like and what's changing over time in terms of impacts and results, and to be able to talk about the story, about the challenges, the successes, and the lessons learned along the way. And it's important to remember that, of course, systems change isn't linear. And so that's why you see the dotted line kind of meandering, where, sometimes you think you know where you're going to go next and you take a little bit of a detour, but it actually ends up bringing you to places even better than you thought. So just keep that in mind as we look at some of the data. Next slide, please. I won't review all of the different types of data that we do collect as part of the evaluation partners for this project, but just want you all to know that it has been some consistent data that we collect annually, both qualitative and quantitative, as well as some data that we help collect periodically or episodically, depending on where the communities are looking to focus their work. And we hear from multiple different perspectives. So both the folks who are involved in the systems change work, as well as parents and caregivers and community partners, sort of parallel to home visiting and family support programs. And I just want to be clear too that the evaluation it has not been designed to be punitive. Or to explicitly be used as like a grant monitoring tool tied to funding. It's really where we have embraced the spirit of continuous improvement, learning and curiosity, and have helped really, to cultivate that with our partners as well. So today we're going to be looking at some limited data, and it's mainly going to be from the systems survey. So I'll talk a little bit about that when we get to it. The next slide describes the 4 buckets of work, we often call them. These are the strategies that are in the theory of action, and we're gonna highlight a little bit of some lessons learned in each bucket, as well as a little data tidbit in each bucket as well. Next slide. So first, internal communications is related to building trusting relationships in order to have improved communication and coordination among home visiting partners and family support program partners. And ultimately, that partners are then engaged and involved in shaping the work, feel a level of investment and commitment to systems change work, and again, just really relying on building trust at the start. And so some examples of how that's looked in the 3 regions over the past 6 years are each of the regions formed leadership and or advisory committees to provide some structure, and then also provides ongoing opportunities for program partners to come together. And so in one region, that's called a lunch and learn. In another region, it's called group connections. In the 3rd region, it's called home visiting gatherings, but they're all intended to bring folks together to understand what each other do, what's unique about their programs, and how they can better work together. Next slide. So some lessons learned in this bucket of work are really that cross-sector stakeholder engagement requires a plan and structure in order for the work to take shape in a meaningful way. And that also requires the time and the space to cultivate the trusting relationships. Otherwise, this work would be stalling out. And that, again, speaking to the resources, that a dedicated position in a neutral organization, so not wed to any specific home visiting program or model, has been necessary to facilitate those processes for this project. So a little data tidbit, the next slide shows how from the annual Stakeholder Systems Survey, which is completed by those who are involved in the systems change work through the project in each of the 3 regions. And so it ranges from about 55 to 90 people per year. It's not always the same people, since some people come and go from this work, but it does provide a snapshot over time of how people involved in the work view the work. And so what we're looking at here is the percent of folks who agree or strongly agree that the home visiting program leaders are effective at working together to improve the overall home visiting system. And at start, about half of folks who participated in the survey felt that that was true. And during that first year, when there was a lot of work being done to establish the leadership and advisory committees and that structure, bring folks together in different spaces and learn about each other's work, there was a dramatic jump in that first year, which has been sustained over time. And we think that a lot of that has to do with the role of the coordinator to be able to bring folks together, create that space, and so that folks can build those trusting relationships and be effective in their work. The next slide looks similarly at 2 systems survey items, both the degree to which folks feel that there's effective communication between home visiting program leadership in the region, as well as between leaders and home visitors in the region. So that's the orange on the bottom. And about 1 in 4 folks felt that that was effective at the start of the project. And you could see in that first year, there was a pretty dramatic jump, but it's also continued to have steady growth over time. And so being able to create those connections between home visiting program leaders, as well as between leaders and home visitors, has been an important piece of the work. All right, next slide is focusing on the second bucket, which is coordinated intake and referral. And so that is so that ultimately families can access the best match and quality services and be referred if home visiting services are full or at capacity. And some of the capacities that help us get there in this strategy is that that there's a coordinated intake referral process or system, and that folks are aware of what's available in the region or community. And so some examples from the regions within the strategy. One region really worked to define the guiding principles and practices for a warm handoff process between organizations. Another region is newly focusing on regular meetings among stakeholder partners, where they review open slots across programs, look at wait lists, and make referrals. 2 regions have an integrated data system where community partners can send families, or families can send themselves. And some of the regions also have additional resources to fund centralized referral coordinator positions to complement this work. So next slide shows some coordinated intake and referral lessons learned. And again, you see those foundational trusting relationships enables this work to unfold more effectively through this project. At the start, there was much more skepticism and mistrust among some programs about each other's work or the individuals involved. And being able to address and acknowledge that there was mistrust at first was important to be able to move forward. For the regions that started a data system, they started small with a pilot process and then expanded, which had been really helpful to address some of the some of the unanticipated glitches in the process, and then be able to work on those before expanding to a wider audience. And then finally, memoranda of understanding has also been an important tool that has helped clarify the expectations and investments of partners involved in coordinated intake and referral. I'm just going to highlight the next slide for this section, even though we have two, but this is to show, again, from the system survey, so the % of folks who agree and strongly agree, that in the blue, that the community uses a shared or common referral form to facilitate family access to home visiting services, where there was very little of that happening at the start of the project. You know, less than 20% of folks were using any type of referral form at that stage. In 2018, one of the regions started that using their data system, and in 2020, a second region started using a data system. And so having those common forms created and a process that folks could use has helped boost that over time. At the same time, it's important to acknowledge that there are going to be informal ways or pathways that programs and families connect. And so whether it's a warm handoff or whatever that looks like in any community, there was a stronger foundation of those kinds of practices at the start of the project, where more than half of folks felt that that was true, and it still grew over time. All right, I'm going to skip the next one, which does show improvement in memoranda of understanding, but I wanted to get to the third bucket, which is shared professional development. And that is, the strategy is to create and maintain a shared PD plan so that ultimately home visiting workforce can access quality services and ultimately improve their practice to best meet the needs of families. So some examples of this within the project have included workforce self-assessments. One region created a very detailed crosswalk of PD competency frameworks. All of the regions have been involved in some way where coordinators are able to help coordinate, organize, deliver PD opportunities and provide support for that, as well as facilitating communication about what PD opportunities are available. The next slide highlights the lessons learned in this bucket around shared professional.
Kelly, I'm sorry to interrupt. I just want to give you about a 5-minute notice.
Great, thank you. So some lessons around PD that has helped move this work forward in this project is truly assessing workforce and community needs and strengths has informed the planning process to identify what already exists and as well as what is needed more of. Professional development that is planned as a series and includes cohorts can have a deeper impact on practice. And then the sharing of PD resources among programs has allowed more equitable access to opportunities in each region. So it's not just those that are well-resourced who can participate, but it can be extended to more of the workforce and cross-sector workforce. So the data tidbit here is a similar pattern to what we've looked at, which is showing growth over time about the home visiting system effectively sharing professional development and training resources. And the last bucket then is around a unified external communication plan. And so examples of this strategy include things like developing new materials that describe the range of supports for families, disseminating materials at a range of events and with partners, gathering input and information from system partners and families about their experiences, making presentations, and of course, working with regional or state partners. So the lessons learned under external communication are that parents and caregivers have unique and vital insights about programs and their experiences. That's important to understand. That a unified messaging around home visiting and family support can be beneficial to programs and families beyond messaging for a single program. And that many families and community partners are still not aware of what home visiting is and what's available. So the last data slide just shows that that is still an area of work to have additional focus on, where even though there's been some growth over time around families in the community knowing about home visiting programs and services, it hasn't been as dramatic as some of the other buckets that we've looked at today. In 2020, we think that that little peak in conversation with partners is around both the needs of families changing as a result of the pandemic, as well as the necessity of programs to be more to do additional different intentional kinds of outreach because of the pandemic as well. So lastly, I just wanted to bring us back to the theory of action and remind ourselves that even though some of these data show pretty, steady change over time, the pattern can look a little different for each region because each region starts with different strengths and areas of growth. The people involved in the work, so coordinators and other key leaders, come in with different strengths in different areas, and so might be able to move the work forward more quickly. Or the readiness of partners, for example. And so the change hasn't always been as linear as some of those graphs suggest that it could be. And again, just the resources required to make some of these changes over the past 6 years really has relied on the coordinator role and their expertise and then their skills that is also supported by the meta coordinator to build their capacity. And we hear time and time again, too, from partners that the role of the evaluation has been really helpful in terms of folks understanding where they are as well as where they want to go. And we use it to celebrate some of the successes over time. So finally, I think just another key resource that Robin, you may have mentioned at the start was related to those opportunities for leaders to come together, sometimes at the foundation, for example, but being able to have the space to reflect together across regions, as well as to do some strategic planning each year has been helped keep folks motivated and recommit to the work that sometimes can feel like, okay, I just want to take a breath. But I wanted to leave folks with that. And I'm not sure if we have time for reflections and questions, but I'll end there.
I think we have time if people want to share anything in the chat. It would be great if people could take a minute and share one takeaway or one idea in the chat related to the Ford Family Foundation's Home Visiting System Coordination Project. Just anything that stuck out to you. Let's try to capture that in the chat. I know some of you are in the car or on the phone, so we will apologize for that piece. Yeah, Serena, you've got your hand up.
Yeah, I was wondering, going forward, I have a question. Going forward, how are you going to balance? Because it seemed like the providers were way up, but then the families were way down. And so how are we balancing that? And what are some of the gaps that you saw that maybe contributed to that difference?
Yeah, that's a great question. And I should clarify, too, that when we were looking at that figure about families knowing about programs, it's people in professional roles who are responding to what they think families know about. So for that particular item, we weren't asking families themselves, although we have asked families about other ways that they learn about or connect with services. But I think that's a great question that the regions are currently kind of grappling with. How are we going to address where we think many families aren't aware of and don't understand or don't know what's available to them or what the potential benefits are. And so there's some work being planned around that right now.
Okay, then I have a second. So are the providers responsible for that, for reaching out to the families, or how are the referrals made to the providers? And then what happens with that? So because I think it starts at the referral piece too, in some instances, or are they currently in programs and then you're just referring them to other things, or how does that work?
Gotcha. And that is a level of the coordination that we haven't been tracking in the same way as some of the data that we looked at. And so the answer is going to be, it's going to vary a little bit based on the community in each of the 3 regions. But the coordinators are organizing some work around really putting the onus on programs to do the outreach and to learn from families, and not to expect families to be the ones to know where to go necessarily if the information isn't easily available. But
thank you.
Okay.
Thank you so much. For both Callie and Robin. There is so much information about this project. There's one of the readings are in your homework to read more about some of their system survey pieces, but these folks are absolutely available to us, I believe, as a committee and as a working team to share their expertise. I know, Julie, I see you have a question in the chat box. I think that might be something that we can follow up with you about how is it that we're only serving 30% with the amount of money that's getting invested in home visiting? I think that's a larger question that we might have time for today, but I'm noting it, I'm capturing it, and that the working team co-chairs will follow up with you and the rest of the committee to try to help unpack that question and try to answer it. I'd like to turn it over to Beth Green. She is going to close us out for this session before we hit our wrap up with Peg and Peter. So Beth Green is truly an expert in home visiting, both here in Oregon and nationally. And I'll just turn it over to you, Beth. Thank you for joining us.